Services.
Thank you, Deputy Speaker. And I also rise today to speak on the Social Services and other legislation amendment lifting the income limit for the Commonwealth Seniors Health Card Bill 2022. And of course, this bill increases the income limit for eligibility for the health card. It really is an overdue measure, and it will benefit so many seniors right across the country. And as we all know, after a decade of mismanagement and neglect under the former Liberal Nationals government, the cost of living in this country is soaring, and the cost of health care has soared as well. In particular, former government put primary care in crisis, with the average out-of-pocket costs for GP visits increasing by 60% over the past decade. And of course, Deputy Speaker, this is impacting our older Australians severely. And remember, our seniors built this country. They paid their taxes, raised their families, and they must be treated with dignity and respect. And they have that with an Albanese Labor Government. And it's an Albanese Labor Government who will increase the income limits for the Commonwealth Seniors Health Card. And this will see more in the pockets of our seniors, because we want to help ease the costs that they are currently facing. And of course, our government went to the election with a plan for a better future for Australians, and we are delivering on that. And Deputy Speaker, the Commonwealth Seniors Health Card serves those who have reached age pension or veteran pension age but don't receive any social security benefits or payments due to their income or assets. And the card provides eligible seniors with a number of beneficial health concessions, including concessional co-payments for pharmaceutical benefit scheme medicines, lowered PBS safety net and extended Medicare safety net, some bulk bill visits to the GP at the GP's discretion, of course, and in some instances other concessions, including public transport, utilities and council rates as well, so a range of benefits. And this will assist seniors, because with the seniors healthcare card, the health card, medicines under the PBS are cheaper. In fact, medicines that may have cost $42.50 under the PBS will then not exceed $6.80. And the seniors health card also provides access to the lowered PBS safety net. And from July this year, this threshold was lowered to $244.80, allowing cardholders to receive their PBS medicines for free upon reaching the lowered threshold. And of course, accessing these benefits really translates into savings for our seniors, particularly for those medicines that they may access more regularly, such as blood pressure and cholesterol medications. In addition, cardholders will gain access to the extended Medicare safety net, and that means once the threshold is met, Medicare rebate 80% of out-of-pocket expenses for the remainder of the calendar year. So that really is a fantastic move. And of course, as I said, the seniors health card can also provide bulk bill visits to the GP if their GP extends that eligibility to card holders. And what's also great about this card, in some states and territories there are variations, but card holders may receive discounts on their property and water rates, electricity and gas bills, ambulance costs and public transport, just to name a few, and that makes a huge difference to those day-to-day costs. So in terms of this bill, it increases the income limit for a single person from $57,761 to $90,000 a year, and importantly may apply to a person who is a member of an illness-separated couple or a member of a respite care couple as well. For a couple, this bill increases the income limit from $92,416 combined to $144,000 combined. Now, these changes, Deputy Speaker, will allow approximately 52,000 self-funded retirees and seniors to become newly eligible for the card. And the new income limits will also apply to both current and future card holders and claimants as well. Now, Deputy Speaker, this bill is a very welcome cost of living relief for our older Australians. I know in my electorate and throughout the country, this has been an issue that many have raised for so many years. Well, the Albanese Labor Government is delivering on our commitment. This will make a big difference to many seniors, because we're committed to restoring affordable and accessible health care for all Australians. Now, Deputy Speaker, the Commonwealth Seniors Health Card has been in place since 1994 as a means of providing access to health concessions for self-funded retirees. And increasing these income limits is a very important move that will affect the lives of many self-funded retirees as they deal with the costs of health care and those costs of living. And by increasing these income limits, our government is taking practical steps to really ease those cost of living pressures. I know how much it will help people across the country and also indeed in my electorate of Richmond. And Deputy Speaker, I commend the bill to the House.